One,
Yes.
2, 3.
Hello. We all know that death is coming at some point. We can always stick our heads in the sand, or we can at least accept it and take control of this last journey part of our life. In the Tao Book of Dying from Doug Smith in 1994, Smith says that letting go there is gain. Giving up there is an advancement. Do not practice controlling, but practice allowing. How many times have you heard those horrific stories from your friends or family of their loved ones that have died that painful, agonizing death in the hospital, totally alone, nobody around them, suffering until their last, and taking their last final breath, suffering all the way through? Well, with hospice care, that will not happen with your loved ones. My name is Crystal Ashley, and I've been a nurse for 20 years. I'm actually working in the hospice field and taking care of patients in their end-life journey. I've been totally honored and privileged to be able to be working with these people and watching them have a peaceful death with dignity and comfort all the way through. When I actually was 15 years old, my father was diagnosed with cancer, and we actually had hospice care in our home, and I was taught by them of how to take care of Dad at the age of 15, along with my mom for 3 months until he had passed. Ever since then, I have been a huge, big advocate for hospice care. In today's world, people aren't even focused on prolonging their life and doing all the tests that they could do to make their life longer, but instead, they have other important personal priorities. In the book Being Mortal by Atal Gawande from 2014, he states that surveys find that the top concerns that people now have mostly focusing on include avoiding suffering, strengthening their relationships with their family and friends and their loved ones, being mentally aware at the end time of death, not being a burden on others, and achieving a sense of their life is totally complete. During this speech, I'm going to let you know the horrible misconceptions of hospice and why you should choose hospice for your loved one. First misconception of hospice is actually a place to go die. Well, no, that's not true. There's two things for hospice. You can either actually have hospice come to your home, or you can actually go to a hospice facility, which we have, I think, 234 actually in Ohio, and then we have in-home care hospice for your loved one. In the home, the patient actually has their own hospice care team, so you'll have a registered nurse, an LPN, physical therapist, occupational therapy. We will have a massage therapist, social worker involved, home health aides, and then we actually bring in the patient's pastor if need be for any spiritual needs that the patient needs. So it's totally in the home or in a care place. The other misconception is that hospice is too expensive for my loved one, so how would I even begin to afford hospice care for them? Well, actually, hospice care is paid for under Medicare and most of your insurances today. They actually pay 100% for all services in the home. They pay for all the nursing, all the therapies, whatever, and even the medications are all paid for, equipment needed such as hospital bed, walkers, bedside commodes, or whatever they should need. So the patient doesn't have to worry about any costs, or the loved ones don't have to worry about any bills, coming to them. The other one misconception is that hospice will quicken my loved one's death. Well, no. Actually, it's been found out that the patients who go on hospice actually live longer due to decrease in their stress, pain. They're more comfortable. They don't have to worry about being a burden to their family. They have all their loved ones there, so everything's they don't feel like that they're a burden anymore, that they know that they're going to be taken care of, and their loved ones can actually have rest and don't have to worry so much. Now I'm going to tell you a little bit more as far as hospice, but how your loved one will die with dignity and respect and quality of life. They're in control of their death. They choose where they want to die. They choose who they want to allow in their homes to take care of them. They're in control of what care they want done, what meds they want, to be on. If they want to go to the hospital and don't do hospice and go to the hospital and get treated and have a totally change of mind, they can do that. That is all up to them. The other thing is, though, hospice provides as much comfort, support with pain management as we legally can. See, the thing is with physicians in today's world, it's hard for them to give out pain medication due to people unfortunately abusing narcotics, things like that. Being on hospice, the physicians don't have that, concern and worry. They are legally allowed to give the narcotics and make sure the patient is as comfortable as they can be. According to Lynn in J2000, about half of the conscious hospitalized patients in a hospital die of serious pain before death. Hospice, that doesn't happen at all. We make sure that their pain is well controlled. Hospice also gives quality and emotional support for the patient and family of loved ones. According to Catherine Quill in 2007, stated that families actually can receive emotional and spiritual support for up to a year after the patient's death. As far as in my conclusion, I hope I have been able to give you why you should choose hospice for your loved one and to make sure that they die with dignity, respect, and quality of life for their end-of-life care.